What you got, Bob? I'm in touch with your clinic about removing of a sebaceous cyst on the back of my head. If I go ahead, what's the chance of it reoccurring? Good question, Bob. The problem with cysts is that you need to remove the cyst wall. If you remove the cyst wall, that cyst should not reoccur. Now, some patients are prone to cysts, so you could get another cyst. I don't know if that's obvious or not, or maybe that, but certainly specifically speaking with that cyst, if we remove all of the cyst wall, then that cyst should not reoccur. So what we aim to do is so that's one of the reasons why surgical excision is kind of the final common pathway for cyst removal, because if you burst the cyst or if you lance it or whatever, and the cyst wall remains, it just fills up again. So what we try and do, so that's one of the reasons we have to make an incision about the size of the cyst, rather than just making a little stab in it and like evacuating it, because we have to get that wall out. So we have to make an incision the size of the cyst. We have to make sure we get it all out. Now, sometimes it comes out really nicely, Bob, and we can say, look, happy days, it's all come out nicely. I know I've got all the wall out. You're fine. Sometimes it kind of breaks apart, and it's, especially if there's been infection there, it's all scarred. The edges are a bit indistinct, and it's like, to be frank, you think, oh, crikey, we always aim to get all of the cyst wall out, but sometimes it's difficult, very frankly, and sometimes you worry that you may not have got it all out, and sometimes if you don't get it all out, it comes back. So there's not 100%. So pre-op, if you've got a cyst on your head, there's not 100% guarantee that we can say that it's not going to return. However, if it does return, we'll do it again for free. But we have had to do that a couple of times, to be fair. So sometimes, particularly if there's been infection previously, particularly if there's any sort of if it's not a straightforward, nice sort of smooth cyst, if there's kind of inflammation in the area, that's why if it's infected, it's best not to have it removed, because they'll have a nightmare to remove when they're infected. So we want to do it when it's nice and quiet. And when you do a cyst in your mind, or in my mind, I always think, oh yeah, it's going to be beautiful. Get a nice plane between the cyst and the surrounding tissues, and you shell it out, and it all comes out as a nice cyst. But the reality of it is that wall can be quite friable, and you're grabbing it, and the forceps kind of break the wall, and the wall breaks up, and all the contents of the cyst come out, and it's a little bit more difficult then to see the plane between the cyst and the surrounding tissues, because the wall is broken. You can often still maintain that, and even though you break the wall, you can try and still focus on that plane and make sure you get all of the cyst wall out, even if it's come out fragmented. So it might look like a mess, but when you're doing the surgery, you can actually keep on track with that cyst wall and make sure you get it all out. So even if it doesn't come out as one piece, if it comes out as one piece, then you got it all out. But even if it doesn't come out as one piece, you can still be relatively confident you've got it all out. So we aim for it not to come back, Bob, is the answer. But there's no kind of 100%, because we don't know how it's going to go in the operation. But if all goes well, happy days. If it doesn't all go well and it comes back again, as I say, we'll just remove it again.